Thank you, Olivia. What Olivia is talking about there, of course, if anyone is, we are able to increase the number of people who see these briefings if we are able to live stream them on Facebook as well. And it's often kind of tricky getting that going, but it's streaming. So thank you all for joining us. Thank you, Dr. Leffler, for being back. And we are going to talk about, as we do just about every Wednesday, we're gonna talk about the pandemic and what's going on here in Chittenden County right now. We have a number of topics to cover. We're going to start out with the conversation with Dr. Leffler, the President and Chief Operating Officer of the University of Vermont Medical Center. So you can see the numbers here. Since we met last week, the sharp decline in new cases continued for a few days, and then it's kind of over the last few, we've hit another little bit of a plateau. We're at 26.7 is today's 7-day average of cases. That compares to about 55 at the peak there a few weeks ago, and that's a countywide number. We talked last week about the fact that after holidays, both Halloween and Thanksgiving, and I think it's probably the case, safe to say the Christmas holiday as well, we did see increases in the number of cases. We hope that does not happen after the latest holiday of sorts, the Super Bowl on Sunday. We'll be watching the numbers. I think it's probably too soon for any infections that came at Super Bowl parties to show up. We did call on and others, Governor Scott and others really urged Vermonters to avoid those inside gatherings through the Super Bowl. So let's hope we don't see a change in trends there. Dr. Leffler, any thoughts on the infection numbers or hospitalization numbers as we get started here?
So, I mean, over the last couple of days, we've seen very encouraging numbers. So if you look at February 8th, which was yesterday, only 60 new cases. That's the lowest number it's been in months. Today, February 9th, 62 new cases, another very low number. If you look at, for months before that, we were always over 100. And so that fits with what we've been seeing in the hospital. Our hospital, we have 9 COVID patients in the hospital today. That's about half we've been running for a couple of months. We have 6 on our floor and 3 in our ICU. And across the state, we're seeing similar downward trends. There's still a little bit of a hot spot in southwestern Vermont, but overall, the hospital capacity across the state is good. And so we're hopeful that these lower numbers of positive cases will continue. We won't see a big uptick from the Super Bowl. We won't really know that for 7 more days or so. So I would say that's encouraging. We know about 11% of Vermonters have been vaccinated at this point with at least 1 dose. That's huge. That's a huge step in the right direction. And we are doing more testing for variants now in the state to see if and when the different variants are here and the impact they're having on our overall success or difficulties with COVID.
So one other thing we wanted to kick around a little bit is even as attention is properly turning towards vaccinations, and last week we talked a lot about the vaccine and how good the news has been out of the trials and the early weeks of vaccinations. It is important to remember that it's not all about the vaccinations at this point. We still have to keep these other systems working well. And there's a further piece of good news is that the cities and the regions testing capacity has continued to grow. And there's really a tremendous amount of free, accessible, available testing right now. And we do continue to encourage folks to use that. People getting tested helps us identify quickly infections, get people who are infected, isolated, trace their contacts, box in the virus. And to that point, the Burlington test site, which has been one of the biggest and busiest ones at 405 Pine Street, the hours of that site are changing, or they have changed, Olivia. Actually, maybe you can help me out here. From 10 a.m., this is now the current hours, are 10 a.m. to 6 p.m. every day to better accommodate demand. There was a little desire to shift those hours backwards in the day a bit. And that facility now has the ability to test over 400 people a day. What do you have any further thoughts on that? Anything to add in terms of testing, Dr. Leffler? Of course, we've talked about that many times before. You can see here another slide is just the increasing numbers of testing has gone up again. That's in part driven upwards by the return of students and the additional tests that happen each week there. It's pretty impressive how much testing is, when given that, I think it's one of the success stories here in Vermont, right? Whereas we've seen nationally really insufficient testing, it seems like we have been able to increase the infrastructure to meet the moment.
So Mayor, like many other things in the pandemic, Vermont has done a pretty good job of getting things in order. And so testing is one of the critical pieces of managing this virus. Knowing who has it so that you can protect them from other people is a critical component of stopping the spread. So having good testing capacity, having people follow the guidelines that we're setting, masks, distancing, hand washing, being careful and thoughtful about gatherings are critical pieces. But you can't emphasize how important knowing who has the virus is. So easy, accessible testing so people know if they're positive and can take steps to protect others is a critical piece going forward. And it will be for a while.
It's another piece of good news hidden in that, maybe not hidden, but apparent in that graph in the upper right corner there. There was a few weeks there where not only were the total numbers of positives going up, but the percentage of positive test rates, which can be a concerning indicator, was creeping upwards, headed towards, you can see in there some days we were even, at or very close to the 5%, which is a number that starts to make some public health experts nervous and suggest that you might need broader health measures. But the average has come back down a bit, and we're down more in the 2% range, which is a much better range to be in.
And Mayor, I couldn't quite do it fast enough earlier, but I did want to share that the new hours you are referencing for the public testing site at 405 Pine will start on February 15th. The current hours are noon to 8. Okay,
great. So current noon to 8, then shifting to 10 to 5 and
10 to 6.
Sorry, 10 to 6. And we are still encouraging folks to actually sign up for specific times at that facility, right? You can register online. There is some capacity for walk-in traffic there, but it's really encouraged that you sign up. It is my understanding. Can you confirm that too, Olivia?
Yes.
Okay, great. Let's talk more about vaccinations. As of this week, 13.3% of residents in Chittenden County have now received at least their first dose of the vaccine. Really encouraging number, up another. I think when we talked last week, it was right around 10, 11%. So that continues, as we expect, every week to creep higher. That is a high number relative to the state and relative to the nation. That flows from the fact that we have both a lot of healthcare workers and staff of long-term care facilities here in Chittenden County, as well as many residents of long-term care facilities. The disproportionate numbers of those individuals being here in Chittenden County has driven up our overall average. We're in week 3 now of vaccinating all Vermonters who are age 75 and older, and 34% of that population in Chittenden County has gotten their first dose. I'm happy to say my parents, not in Chittenden County, but down in the Upper Valley, this is really exciting to see them come out with their photos of their shots. Actually, they didn't do a great job taking photos, but photos right after the shots. And it's starting to change the mood, I think, and how we understand where we are in this crisis. What do you think of those numbers, Dr. Leffler?
I think it's important to remember that we're in the largest public health effort of all of our lifetimes. So getting Americans vaccinated against COVID-19 and getting it back under control is literally the biggest public health initiative we'll do in our lifetimes, most likely. And so, seeing the numbers go up every week is gratifying. I wish it'd go faster. I wish we'd get more vaccine, but the state is doing a great job of getting vaccine to us, getting it out there, getting it to people who are at highest risk. And we have good partnership with the state and our local pharmacies and others to get vaccines into arms. So I think Vermont is actually, once again, in this area, done a good job of collaborating and being focused on what's important, and that's getting people vaccinated. I love seeing the number go up every week. I just wish it'd go a little faster, but we're getting there.
And I think if I'm reading the chart right there, the left-hand chart does show there has been an incremental increase in the number of doses administered each week. It is creeping upwards. We're hoping to see that continue to grow as more vaccines are approved and as the manufacturing capacity of the approved vaccines continues to expand. There is another aspect of the state and city's efforts to get people vaccinated is to ensure that it's done in as equitable a way as possible. And we had real concerns about reaching and getting vaccinated quickly those members of our community who have limited English proficiency. And the state announced something we've been in conversations with them about for some time at the end of last week, that they're conducting additional clinics for Vermonters who have limited English proficiency. It's something that we applaud and welcome that Dr. Levine and the Department of Health are taking this step. The city, not just the city, it's Burlington, Winooski, but other organizations. I know your organizations, Dr. Loeffler, and others had been advocating and supporting the state in doing this. And I think it's a really healthy step. I'm going to keep advocating for steps like this. By adding this additional allocation for members of our community who are not as proficient with English, the state and the Department of Health are recognizing the reality that removing barriers that otherwise might prevent eligible Vermonters from getting the vaccine needs to be a priority. I think this is what an equitable pandemic response looks like. Dr. Loeffler, do you have any other thoughts on these clinics?
Couldn't agree more. I'm fully supportive of getting vaccine out to people who need it. We do know that some of our more vulnerable community members are 3 to 4 times more likely to get COVID, end up hospitalized. And we know nationwide they're more likely to die. And we do know that some of our more vulnerable community members don't go to nursing homes. If they're 75 plus, they live at home, and their caregivers are their family members who speak their language. So I see going into their households and vaccinating them and their family members is just like going into a nursing home and vaccinating them. Ultimately, it keeps us all safer, and it's the right thing to do.
So there are a couple other kind of groups of residents that we're concerned about, not just limited English proficiency residents, but also those we really seniors who are homebound is another population we're concerned about, as well as BIPOC communities. Some of the early vaccination data shows that the percentage of Black Vermonters getting vaccinated is about 6.7% of that population so far, compared with about 10.8% of the white population, suggesting that somehow we're seeing a troubling racial disparity start to open up there, as well as we've seen in other elements of this pandemic. There's a variety of reasons for that. Certainly, one of the historic ways that BIPOC communities have not been properly cared for and even abused at times by past health efforts, I think is undoubtedly playing a role there. But to agree that there are barriers that we can break down through outreach and communication, we're attempting to do that. We want to make sure at very least that BIPOC residents have the information and access that they need to make a decision about the vaccine. And we are advocating for and pursuing a variety of equitable outreach efforts to continue to try to keep this gap as this disparity as small as possible and ensure that BIPOC residents have the information they need. Again, I know this is something that Dr. Leffler, the hospital, has been concerned about and working on. Do you want to add anything to that conversation?
I'm just glad you raised the issue, Mayor. We have been working hard on making sure that people have the information they need to make good decisions. Actually, before there was even a vaccine available, we did a lot of work around the vaccine trial we participated in to make sure that people had the understanding of the trial and and how it would work and understand issues that we could address. We've worked very closely with multiple partners in the community, such as the Association for Africans Living in Vermont, our BIPOC partners, to make sure we've held a number of sessions with our infectious disease doctors. And I agree with you that our job is to make sure that the barriers are as low as possible for everyone to get vaccinated, and that we're able to answer questions and make sure people can make good informed decisions on if the vaccine is right for them.
Well, very good. Thank you for coming on. Once again, Dr. Leffler, thank you for all the work that's happening at the hospital. We will be back in touch again soon and have you back on.
Talk soon. Thank you.
Take care. So our next, I want to talk a little bit more about our ongoing effort to vaccinate all Vermonters who are age 75 and older. Brian Lowe, our Chief Innovation Officer and our COVID leader, who has been hard at work on so many elements of the pandemic, is back with us. And it looks like you're working looks like that's a City Hall shade behind you there today, Brian. You're actually in the building?
City Hall today. We're getting, we might be getting a shipment of masks either later this afternoon or tomorrow morning. So I'm here to get it if it comes.
Excellent. We have, generally, we have most city workers working on a work from home posture whenever you can. And we have some renovation work going on at City Hall. So it's we don't always see you there. As I've shared before, the city does not have a direct role in the vaccination effort, but we're working hard to support the state in any way that we can and to make sure that all our residents have the information that they need about the vaccine, as we were just talking about with Dr. Leffler. To that end, the city is working closely with seniors groups in Burlington to identify additional ways to reach Burlingtonians who are 75 and older, and be sure that every senior in Burlington knows about the vaccine for COVID-19 and how to get it. It may seem to some of us like this information is everywhere, but we know that we have not reached all seniors, even in this very high risk population. There are still significant numbers of people who have not yet signed up. So we are continuing and are stepping up our education efforts. And let me say right out at the outset, anyone listening to this, if there's any question about this, know that the vaccines are free and they are safe. Millions of people have been vaccinated, and there has been no deaths from the vaccination or reactions to it. And it's just been an extraordinarily successful vaccination effort so far, as we talked about last week with Dr. Leffler. And we are starting to see a drop in hospitalizations and severe cases and illnesses and deaths, certainly in vaccinated populations. So one major concern around the vaccine accessibility for our seniors is, how do we reach those that can't make it to these clinics? How do we reach those that are homebound? And here there's an answer, and that's what we want to talk about a little further. If you are a senior, 75 years old or older, you can call AgeWell, the AgeWell helpline, for assistance signing up for COVID vaccinations at home. And you can also get help getting registered and with transportation. Brian, would you like to say a little bit more about these services and how they work?
I'm happy to, Mayor. AgeWell is an organization that serves those who are 60 or older in Vermont, as well as those who are under 60 who have a disability. And this is a service that they are offering. We met with them and discussed this, and they are working closely with the state and some of the home health agencies to help make vaccination more accessible to seniors that are homebound. So calling them, talking with them, if you are in that eligible category, 75 or older, they can help you navigate how to get that vaccination if it's hard for you to get to a vaccination site.
And is that Do you know, Brian, does the individual have to make the call themselves, or if you're caring for an older Vermonter, can a relative call and help get that information?
That is a great question. We talked a lot about the importance of those kind of care providers. So my assumption is that yes, a care provider could call, but I did not explicitly ask AgeWell that question.
Okay. AgeWell is a great organization in Chittenden County. People may remember we've had them on these briefings before. They've distributed many emergency meals. They really run the Meals on Wheels program and stepped up those efforts during the pandemic. They serve Vermonters over 60 and also some Vermonters under 60 who have some form of disability. And I really want to thank them for adding to their services this important initiative. I think this is really going to help fill some gaps in getting vulnerable seniors vaccinated. I also want to thank the Heinenberg Center, AARP, and other senior providers who have been working hard to get the information out and get folks who are eligible for vaccination into the system. Understanding and advocating for transportation options will continue to be a focus for the city in the days and weeks ahead as we get further into this vaccination effort. Let me, I think, just add to this. I want to speak directly to some of our seniors, because one thing that we are hearing from providers is that many seniors are waiting to register because they believe others are at greater risk. And that is a really unselfish attitude, and applaud you for that. And we want you to move past that now. You getting vaccinated now is helping our community. There's enough vaccine for everyone 75 and older who would like to get vaccinated in the next few weeks here. So we really urge you to sign up now. There's no longer a reason for you to wait. The state is setting aside the limited doses for seniors 75 and older because the data says that it's really people in that age group who are at the greatest risk on a personal level. So again, if you are eligible to receive the vaccine, if you are a Vermonter, a Burlingtonian, a Chittenden County resident that is 75 years or older, you are eligible to receive the vaccine, and now is the time for you to get your vaccine. Last topic we wanted to discuss today is one we've talked about many times before on the briefing. We want to talk again about masks. We know that masking has become one of the most important strategies for containing the virus until everyone can be vaccinated. In recent weeks, there's been an increasing focus and national discussion on wearing high quality masks, especially with concern that we may soon have some of these more contagious variants of COVID-19 here in the area. We continue not to see that in our wastewater, Brian, right? We have, what's the latest there is we still have no variants detected, right?
No variants detected yet. Next samples come back later tonight or tomorrow.
We do think it's just a matter of time, however, because until that happens, the national news has been that the variant has the presence of it has been doubling about every 10 days recently. So at some point the variants are going to be here. What we know is that one thing to be focused on, a way that you can step up your efforts, is to have high quality masks that have multiple layers and a snug fit to reduce gaps in a tight weave, so that if you hold it up to the light, that you don't see light passing through. That's an indication of a tight weave. Early on in this pandemic, the city coordinated the production and distribution of 26,000 free, high quality, reusable face masks and distributed them here to Burlingtonians. We have now, what we're announcing here is that we have procured 3,000 additional new high quality masks. We've sourced these from a local company called Masking for Good that works primarily with Bosnian American sewers who live in Winooski. And we are prioritizing essential workers in the distribution of these masks. So again, we would encourage people, if you are an essential worker or you have essential workers working for your organization, and they do not have high quality masks, we invite you to reach out to the COVID-19 Resource and Recovery Center and request masks. We will also be have started checking in with the essential businesses in Burlington to see if they have any new need for these additional high quality masks. If you are a worker yourself, feel free to reach out directly to RRC. One of the reasons we're doing it this way is because many essential workers, if they are younger, if they are not in, the way Vermont is choosing to distribute the vaccine, which I support, younger individuals may be waiting for a while, even if you are an at-risk essential worker. That's why, these tools, having high quality masks is particularly important, and we've put some additional resources into this effort. Brian, you want to add anything to that?
I think just emphasizing your point there, that I think the state has a vaccine strategy that focuses on age. And so the city is stepping in here with a complementary strategy to try and protect or help protect those who will continue to face some kind of exposure risk in the months ahead. And we'll also be calling back through the list of organizations that we worked with in the spring to see about their needs. We know that many people have masks different than the spring, and so we don't expect the same level of demand, but we really want to make sure we're reaching out, particularly to smaller businesses that have a number of employees and are busy. We want to make sure that they have an opportunity to add additional protection for their people.
Great. All right, thank you, Brian. With that, I think we'd be happy to take any questions from members of the media.
Great. And a reminder for members of the media, you can let me know that you have a question by sending me an email. And the first one just came through. 1 second. All right, first question is from Lauren from NBC5. And Lauren, you should be able to enable your microphone.
Hi, Mayor.
Hi, Lauren. Good. Welcome back.
Thank you. So I'm not sure if I just missed this, but I know, you brought up kind of the racial disparity that we're seeing with vaccine distribution so far, the number of Vermonters, white Vermonters versus Black Vermonters who have gotten vaccinated. Can you talk a little bit more about how the city is planning to tackle this and how the city is planning to address this?
Yes, Lauren. Well, part of what we're doing is bringing attention to it, having a focus on the disparity as it's emerging, having this conversation we're having with you today. As I stated before, I think there's a number of complex reasons for this. We know that part of this is a intentional choice on the part of some BIPOC residents. We know there's real skepticism in BIPOC communities. A variety of polling has shown this nationally. There's skepticism, sort of maybe even greater levels of skepticism, given the history, shameful history in this country of mistreatment of BIPOC individuals by the medical establishment, in past public health efforts. So there's sort of an understandable, I guess I'm trying to say, reluctance on the part of some folks to sign up for this early, and that might be one of the drivers. What we want to make sure is that education and information is not driving this. We want to make sure that all BIPOC residents are fully aware of the latest data, which is very positive about the vaccine. The information we talked about last week with Dr. Leffler, that of the 75,000 individuals that went through trials, experimental trials, not a single one of them was hospitalized because of vaccine. Not a single one of them got COVID and had to be hospitalized or died. It's been these vaccines are incredibly effective. We're working to get that information out through all the channels that we've set up during this pandemic, our rapid response team, our Trusted Community Voices program, working with partners like AALV, working with the state, really using every information channel that we know of and can think of to help get the information out. Brian's been kind of on point, a big participant in this. Can you add to that, Brian, how we're trying to address this?
Yes, Mayor, thank you. I think that, Lauren, it's probably going to be different strategies for different groups of people over time. And I think those strategies are going to be informed by what we hear from those different communities. I know the state announced last Friday that they have set up separate clinics specifically for folks with limited English proficiency. That often overlaps with a component of the BIPOC community. There are other communities within that broader BIPOC community in Vermont that have different needs, different questions, different concerns. And so I know that the state is thinking about how best to enhance their outreach and improve access for all those different communities.
Okay, thank you. And then I know Dr. Leffler had also mentioned at home administering for the vaccine. I'm not sure if I just missed this as well, but is this just, are these plans in the works, or is this discussion right now, or I guess where's that process going?
So Lauren, we were sharing today that there is a system in place now for folks to get help who are homebound, and it's by calling that number, that the Age Well number that we had up there on the screen, and
Okay.
and they can help troubleshoot and figure out how best you can get vaccinated. That the options can include getting transportation assistance for some folks, assistance with the signups, and for some folks that just that, you know, it's kind of navigating the call center or the online signups that can be a challenge. But there is also now starting to be the capacity for Age Well to coordinate actual in-home vaccinations. Brian, you want to add to that?
I think that's exactly right. And I think it's another community that we want to make sure we're reaching. And I think that number is important. It's the 1-800-642-5119 is the Age Well helpline.
Okay. And off the top of your guys' heads, do you know if this service has been used, you know, since it started, or any kind of numbers?
I know that it has been used. I don't know the magnitude of the numbers.
Certainly something we'll report back on as this evolves, Lauren. I think it would be, we're very focused on this issue, and any data that we can report out in future weeks, we will. A step towards that is, we appreciate the question and the help in getting the word out that this system is available. It's, we're in just week 3 of the community vaccinations, and this is the first week it's really been clear how this home vaccination effort was going to be resourced and organized. And so I take it as a step in the right direction that Age Well is now set up to start doing this.
And it does look like Tracy Schamberger from Age Well was tuning into the briefing today and has raised her hand. So Tracy, I'm going to take that as a sign that you are up for being spontaneously put on the spot, and I'm going to make you a panelist in this meeting in case there's anything that you'd like to add to this conversation. Thank you for being here.
You're on mute, Tracy.
Thank you. Hello, Mayor Weinberger and Brian. Thank you for having me.
Welcome back, and thanks
Yeah.
for your work here. And great if you can add some information. That's awesome.
Sure. So I know there was a question by Lauren about whether this service has been used, and I want to let you know that Age Well has had a helpline for many, many years. And so we have already looked at the clients of ours who meet the current criteria for immunization, and we've reached out to them to make sure that they have the support that they need to be able to get immunized. Also, the people that answer our helpline, our information and assistance staff, are well connected with the resources in regard to what is the best place to get tested, and also be able to answer a lot of questions. For the question specifically around who can call the helpline, anyone can call the helpline. You do not need to be 60 years old to call the AgeWell helpline. You may be someone who's living in the same household. You may be a next door neighbor. You may be a caregiver. You may be the child of an older Vermonter who needs to be immunized and has concerns or questions. So I want to just say that, you know, from the standpoint of calling the helpline, I don't think there's any reason not to call the helpline if you have a question. And we have been helping connect people with the resources to get immunized. Our biggest concern, obviously, like anybody's, is getting homebound older Vermonters immunized, and we want to make sure we're reaching those people. So, you know, feel free to call the helpline to get someone registered or to get advice or information. We're happy to take on that body of work. It's gone very smoothly, and we don't expect that there'll be any issues with being able to get through.
Okay, and that started this week, or is it today?
Well, it started when we were notified that the population that we serve, you know, 75 or older, was the vaccination could be rolled out. So it started right at that point. We do get a lot of people who call that don't have access to technology. And that's our biggest concern, is that, you know, a large majority of the of older Vermonters, currently the 70 and older community is not necessarily on Facebook or online at all. And so that's our biggest challenge, is being able to make sure that we're able to help people that call in because they may not have access to the technology to register through the VDH. So we can help them with that process.
Thank you so much.
Of course.
Thanks for joining us, Tracy. Are there any more questions, Olivia?
Yes, the next question is from Pat Bradley, and Pat, you should be able to enable your microphone now.
Hi, Mayor. How are you today?
I'm great, Pat. Thanks for tuning in.
Yeah, I wanted to ask some off-topic, you know, not the vaccination program thing. And I don't know if other reporters in the Burlington area have already asked you this or not, but I had monitored and watched the Burlington City Council meeting on Monday night, where they pretty fundamentally changed your public safety plan. And I'm kind of curious, what happens now from your perspective? You had said that they would compromise safety if they changed it, which obviously they did. So what, from your perspective now, can you do? We've got town meeting day coming up with the mayoral election. Do we wait until at least April for anything to happen, or have you got something in mind, or what's happening now with that?
Thanks, Pat. Well, no, I think you're right. It is pretty clear that this the current council is not. We have put before them twice now proposals to address the crisis that the council created by eliminating, with over a matter of days, 30% of the officer positions, and we are on a trajectory. We've already had to curtail public safety services as a result, and we're on a trajectory for major curtailments if something doesn't change. It's clear that it will not be a change before Election Day. The only way to fix this now is for voters to fix it at the ballot box, and that is, I do expect this is probably the most defining issue in this mayoral election and in some of these city council elections. And I think people who are concerned about the direction that the council seems to want to take the city at this point need to weigh in. And if voters are concerned about that direction, they need to let us know with their votes on town meeting day.
I did notice that Councilor Hightower said that she didn't think that the city is in a crisis. where's the disconnect between your perspective versus the progressive perspective?
So, Pat, from my perspective, no longer being able to answer the calls of Burlingtonians, if they, no matter what time of day they come in, that would be a crisis. From my perspective, having to curtail an overnight shift, as Chief Murad has been warning for months, will be necessary soon. That's a crisis. Apparently others, you're right, don't seem to feel that or think it somehow can be avoided in yet to be defined ways. But I think it's others are certainly entitled to their views. From my perspective, it's a very serious situation. It's not just my perspective. The police commission endorsed the public safety continuity plan because they're concerned about the direction. And in fact, we had 20 former elected officials who were part of this tripartisan consensus who had established that the city needs about 100 officers to properly police the community. That had been a long-standing, durable tripartisan consensus, establishing that for decades. That disappeared in a matter of 3 days from when the proposed change was first articulated to when it was implemented. And I think it's a very serious mistake, and the voters need to fix it.
If they had only changed the CROs and the liaison officers, because if I recall, they basically added those positions there.
No, they didn't that's important. They didn't add any positions there, Pat. Though that was part of my proposal. In fact, all that they did is slow those down. If they had approved the resolution on Monday, those positions would exist today, and we could start filling those new spots, which are something I think the community further very much wants us to do. Instead, in a move of kind of remarkable micromanaging, the council has decided to that they want to. The council, it wasn't clear the council realized they had been given job descriptions, although they had them for weeks. There was a statement that they didn't think they had job descriptions for those positions. They did. And then they sent this off to various council committees to write the job descriptions. The council committees have been moving very inefficiently on these public safety matters. So this really could be a significant setback to the creation of those positions, that they did not approve what was in front of them, which was a surprise. There had been no communication to my office or the police ahead of time that there were any concerns about those job descriptions there. So but it would be a misunderstanding to suggest that the council somehow was creating those positions. That was part of the public safety continuity plan that the chief and I presented.
And my understanding is that would have been a pilot program?
We did propose it as a pilot in the sense that these were, we proposed it as a pilot because we're very aware that we have committed ourselves to a full operational assessment of the police department by an independent professional. And we want that assessment to be complete before it seems appropriate to me that that assessment be complete before we make kind of permanent new changes in the direction of the department. Further, it was envisioned as a pilot in that we think once we have more, we already have some community service officers. Having more like this, going from 2 to 6, will give us an additional kind of understanding of how we can best use people with this kind of background. And so while we think it's likely we would further expand the program to maybe double it, maybe another 6, we thought having a pilot where we experimented, we tried out these professionals responding to certain types of incidents, that would inform how we further expand the program. So that's why, that's really the main reason why we proposed it as a pilot.
Thanks, Mayor. Thanks for clarifying some things for me.
Yeah, absolutely. Thank you, Pat. It was very hard to follow what had happened. So no, we've spent the last couple of days trying to figure out the implications of the language that was added there right at the end. So it makes sense that there would be, you would need some clarification.
Yeah, by the time it gets around to midnight, 12:30 in the morning, yeah, you start getting confused a bit sometimes.
Thank you, Pat.
Thanks.
Great. And it looks like that is all the questions for today.
Great. Thank you, everybody. Thanks for tuning in. Tracy, thank you very much for coming on, and thank you for everything that you're doing with Age Well. And keep us posted. We're very interested to hear how these new efforts unfold and anything we can do to support them.
Of course, and we'll be seeing Brian during the Senior Providers Network. So that'll be perfect, and we'll be able to give you some real-time updates because, of course, we track all that data.
Awesome. Thanks so much. Take care.
Bye-bye.
everybody.